Hi everyone, it's me, Maddie. It's April 11th right now. Sorry I haven't done any updates in a long time. Nothing has really happened in jaw world in a good 2 months, I'd say. A month and a half. So remember the last time I talked to you guys, I went to the orthodontic surgeon. Or maybe I give you guys an update about my appointment that I had with Dr. Rombach, my orthodontic surgeon or oral surgeon. Um, Basically, he went over what my treatment, he did a lot of measurements and everything, talked to me about my issues, and basically was going to come up with a treatment plan that was going to take several weeks for him to get together with the measurements, the calculations, the prognosis, the diagnosis, blah, blah, blah. My treatment plan for pre-surgery is what takes so long to get the surgery done. We've discussed this before. I'm getting top and bottom braces, rubber bands, probably like the whole 9 yards. I think I'm getting like a tongue thrust device. It's going to be like crazy, 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 crazy. I'm going to look like I'm like 7 years old, and because I have a tongue thrust and my tongue touches my teeth when I swallow and when I talk, or I guess it's just a swallowing issue. So it's going to be this thing right here that's like a metal bar that stops me like here in my mouth so that my tongue doesn't have contact with my front teeth, so that when I get surgery and my upper jaw is moved back in again, it won't be used to pushing and mess up my whole face again. So, to reiterate, this surgery is going to correct an open bite and overjet that I have from sucking my tongue for too long when I was a kid. So, this surgery is kind of strange because it's putting me back to where what I would have looked like and functioned like if I never did that as a child. Kind of crazy to think about, very frustrating if you're the patient and paying for it and going through with it, because I knew it was a problem as a kid. I just didn't know, like, it was an attachment issue. Obviously, there's reasons why these things happen. They're psychological, and it's attached to your body. So if I didn't have a treatment plan and I was 7 years old, I didn't give a crap. Oh well, whatever. So anyway, I got a phone call on Wednesday about from the office, Dr. Rombach's office, my oral surgeon's office, and I think her name was Diane or something like that. Anyway, so she called and she said, "Hey, we want to meet with you, finally." It's already been 7 weeks. Everything's flown by. I got a new job and everything, so everything's been flying by. She's basically said, like, she wants to meet or set up an appointment for Dr. Rombach, my oral surgeon, and Dr. Kulbersh, my orthodontist, to collaborate and meet with me to talk about my treatment, my prognosis, my surgery, what it's going to be called, how long it's going to take, blah, blah, blah. My, braces I'm getting on, which is a whole issue. So that appointment is April 30th. That's less than 3 weeks away. So my ducks are kind of getting in a row, I feel, and the timing is really strange. I started a new job 4 weeks ago. I just finished my 4th week at this new company. So, not to bore you guys, but when you have a new job, sometimes you have to wait 60 days to get approved and able and eligible to enroll in the company's healthcare system. So I will do that, but I want to make sure that my primary insurance, which is under my dad's, accepts the surgery and will help cover it if they deem it not cosmetic and an actual reason to get it done from health issues. So I will do this process over again, I'm pretty sure, once I get enrolled in the new health insurance plan to get some more help. I still have to talk about that. Like, I'm kind of like, it's almost like I'm starting over again, but I'm even more confused because I'm not even in this insurance company yet, and I don't know if I have to wait longer to get accepted for this surgery since I'm a brand new customer for this new company, this insurance company. Which is kind of crazy. What else am I going to talk about? So, with that, HR. There's HR things with taking time off, paid time off. I get 8 days a year I started in March, so it's 8. I think you started for the full year, it's like 10 or 12 or something like that. But next year I get 16 days off. So the year starts on the 1st of January. But you don't get short-term leave until you're there for a full year or something like that. So I'm trying to debate whether or not I save up all my personal time, have the surgery around the holidays or something, like depending on how long I need to be out for when I can get my surgery, how long my braces have to be on. This is all hypothetical. And use those days with the weekends and the holidays combined, stay home for 2 weeks, work from home for another, work something out where I can, like, get it done. Because I'm not worried about personal time. Like, I'm okay with having 3-day weekends, having holidays off. That was kind of what my internship was like anyway. I didn't really take a whole week off, except for the bowl game, because I didn't know if I was going back in my internship or not. So that's that. I just really have to, like, see with HR what I can do with that. My work is very flexible. My boss is going on maternity leave in 2 months for 3 months, so the whole summer, like up to like beginning of October. So I have to plan this around her. I already mentioned it to my, director and everything like that, and she was like, we'll take care of it. We just want to make sure it's at the same time as, your other, employees' time, because we need you to do what she's doing when she is gone. So it's all kind of, up in the air, but at least the stuff that is medical is getting paid attention to. Everything else will fall into place. I'm not really worried about that as much. It's just a financial and medical thing and getting every appointment lined up, everything like that. So that's basically that in a nutshell. I'm still wearing the mouth guard, bite splint thing. Not as much. My new job has not seen me wear it during the day. And I justify that as, well, my surgeon got my x-rays. They know what it is. They know what it looks like. They know my jaw size. They know everything. I'm just wearing it for comfort at this point, because to me, like, I don't want to wear it at work anymore, because I don't want this new company to think I'm like a nut job and just like have ailments coming left and right as a new hire. Plus, it's kind of embarrassing. The thing is stupid, so I'm not going to deal with that. I have to talk a lot more now at this job, more interactive, blah, blah, so I'm fine with just wearing it at night and when I drive and when I'm just sitting at home doing nothing. I'm getting real sick of that thing, though. It's just, I've had it for like 6 months, like going on 7 months, I think. I started it in mid-October. Maybe it's just completing 6 months. So I'm looking at my calendar over there. So, yeah, that's fine. The mouth guard's fine. I had a filling done about 6 months ago, right before I got my bite splint, that, it's over here. So it looks like a little baby tooth. They messed it up. They didn't do the cap right, so it like broke off. But they want to fix it, but I'm worried I don't want to get it fixed right now, because then my bite splint won't fit. Because there'll be like a new part there that was originally a bump. And if I have it filled, it needs to be like this in my bite splint and not like this. So it won't fit. Because even the smallest thing, like if there's like a teeny little piece of fuzz in my bite splint, it hurts. Like I could feel it. It's really strange. So yeah, that's pretty much it at this point. I'm just still waiting. But things are moving. Things are going well. I'm just ready to get this done. Like every day I look in the mirror, I'm just like, oh my God, my face is gonna be different this time next year. Oh my God, oh my God. Oh, forgot to tell you guys, duh, I got a letter in the mail from the orthodontic surgeon a couple weeks ago before I got the phone call saying we submitted everything to your insurance company. We are deeming you eligible for an orthognathic, I still don't know how to say it, upper jaw surgery, because they were just using it from like, visual liability, not measurements yet. They don't know if they're going to move my lower jaw, but they, did that, and they said optional genoplasty. So it's in there. It's funny because the upper jaw surgery is like $625, the genoplasty is like $1,200, but the thing that costs the most is an anesthesiologist and the hospital stay. So I'm thinking, and I've talked to, my mom about this and my family, some friends. It's like the chin is just for proportions and looks. However, it's not functional. But if the outcome of it, getting it done with the surgery under the knife one time, anesthesiologist one time, doing it right the first time, if it's suggested, I'm going to go ahead and do it, because I don't want to have to be like, wow, my face looks really weird because I didn't move my chin and my lower jaw is different, my upper jaw is different. Damn, I should have taken their advice and done it, because if that is the case and I regret it, it's almost impossible. It's a cosmetic surgery at that point, because it has nothing to do with functionality of my mouth. It's just my chin moving. It's kind of like getting a nose job. Doesn't really do anything unless it's a septum problem. But that being said, I'm going to go ahead and do that because, I don't know, I've just decided it's like I might as well go all or nothing with this thing, so I'm doing all of it. I might as well, like, what's another $1,000 when you're paying 30 grand? Might as well do it right, right? So, that was, yeah, given to me a couple weeks ago, so I've been waiting for that phone call that I just told you guys about, which happened 2 days ago, which is good. So, at least I was informed of what I was getting done, and I could kind of plan. I'll really find out in 2.5 weeks of what's going on, when they're going to put braces on me, planning everything, you know, making sure my insurance company accepts this. I haven't heard back from my normal insurance company yet. So it's fun. But anyway, I thought I'd give you guys an update of what's going on. I'm having trouble talking still. Chewing is kind of weird. Everything's really lopsided. So it's my bite. Yeah. So, like, this is all. Yeah. The day that my teeth go like this and not this, I'm probably gonna cry. Just be like, oh my God. It's, it's gonna be crazy. And I'm excited. Um, I just keep telling everyone, like, this is going to be shorter. It's going to, I don't know. I'm going to look more like my siblings now. It's going to be kind of weird. So, yeah, anyway, sorry I'm blabbing. I just haven't been on here in a long time. But I will let you guys know what's happening after that April 30th appointment. Thank you for everyone who's been watching. Also, I've been getting some feedback from bloggers, jaw bloggers, which is kind of cool. So I'm getting some attention out there, getting some advice, getting some public eye opinion, helping other people out that have the same issue going on. So if you have any questions, let me know, because obviously I'm obsessed with knowing everything about this, every complication, every process to go through it. That being said, I've never been through this situation. I obviously haven't had jaw surgery, but when I get, something comes up with my health, I always want to research it and know everything about it so that I'm educated when I have to confront it in my life. So, that being said, I will talk to you guys later. Thanks for watching.